On the Health Watch, it is the holiday season, but you might not be feeling so cheery and bright this time of year.
Yeah, shorter days, less sunlight, that can trigger depression. Joining us now to talk about seasonal affective disorder, Dr. Lisa Ravindra with Rush University Medical Center. Thanks for being with us.
Hi, thanks for having me.
To talk about an important topic, and you all said you're very busy this year with specifically seasonal affective disorder. It's already so dark. The sun just set a few minutes ago. What does this do to us, this darkness?
Yeah, I think it's really interesting. Just looking out the window, I think a lot of us feel a little bit of the winter blues or a little bit down when the days are shorter in the fall and the winter. And then sometimes we feel a little bit better once the hours are longer of daytime, when spring comes around. And some people feel this a lot more than others, so they get more severe symptoms of mood changes, more fatigue, needing to sleep more, higher appetite, maybe weight gain, isolating themselves. So we see a lot of that around the winter time.
Okay. It is certainly okay for people to get help. When should they see a doctor?
Yeah, I think it's always a good idea if you start to feel like you're not enjoying things the same way, or you don't want to see your friends, or just not getting the enjoyment out of life like you usually do. Especially if there's a change in seasons, then there's something that we can do about it. And it's a good idea to talk to your primary care doctor first. Sometimes that's an easier way to get in than seeing a therapist or a mental health specialist, and maybe less stigma as well.
Sure. I'm the type, I'm still doing this, right? It's like 5 o'clock or 6 o'clock, and I'm like, it feels like 11 o'clock at night. So I'm curious if there are any tips, whether it's get more sleep or things we can do outside of the doctor's office to give us a fighting chance against the winter blues, especially because it's only December. We've got a long way to go.
Yes, so studies have shown that sunlight really affects our sleep-wake cycle, so our circadian rhythm. And we know that we don't get a lot of sunlight, especially here in Chicago between December and February. So those are the months that are most severe for mood changes and that we need to be aware of. So it's best to talk to your doctor for a good treatment plan. It could be anything from just spending more time outdoors, or medication or talk therapy. What I always recommend for people is regular exercise, adequate sleep, and a healthy diet. But specifically with seasonal affective disorder, we like to promote spending more time outside, even in the cold.
Even in the cold?
Even in the cold. Okay. It's been shown a 60-minute walk in the morning can be very effective in combating some of the symptoms, as well as even just sitting by a window. So you guys are in good hands here.
Oh, good. We have so many windows right here.
Good advice.
Yes, and uniquely with seasonal affective disorder, we can use light therapy with light boxes.
Yes, yeah, and those do make a difference.
Yeah, they do, and studies have been pretty clear on that. If you spend a half hour a day in front of a light box at the right intensity, it can really help with symptoms.
Okay.
Dr. Great being with you. Thank you for the advice.
It.
A lot of people need it at this time of year.
Yeah, we'll be thinking of it over the next few months.
Thank you.